According to latest CDC guidelines, you don't require a negative test after 14 days of infection, especially if all symptoms have resolved. The PCR test, however, can still stay positive 10 to 14 weeks after infection. This is because the test itself detects the presence of nucleotide, which can be present in your body even after the infectivity period is done. So what you need to know is how long you will stay infectious once infected with COVID. So the latest evidence suggests that you can be infectious from day 1 of symptom onset up to day 10 of symptoms. That means the day your fever or cough or headache starts until the day 10 of the symptoms. Whether the symptom have resolved or not, the infectivity period ends by day 10. With the amount of safety netting, we can safely say that you are not infectious, especially after day 15 of infection. There are a lot of people who are still worried about interacting with others even after this infectivity period. So for these, we can suggest using a normal surgical mask. Let us also discuss this graph to highlight more about the period of infectivity. As it is clearly seen, the lowest bar represents infections period. This is from the 5th day for 5 days before you have infection, as in the symptom onset, whether fever, headache or cough, up to 10th day of your symptoms. Also in the graph, you can see the pink bar which shows PCR test can stay positive for a long period although the infection has subsided. So keep this in mind if you feel that you are asymptomatic but still being tested PCR positive. This does not indicate that you are infectious. It only shows that the nucleotide is still present in your body. After 15 days of your symptom onset, we can, from the current data, easily say that you are not infectious. The only one advisable precaution is to use a separate washroom for the COVID-19 patient, as we still don't have solid data whether there is a fecal transmission mode for COVID-19. If this is impossible in your current setting, you can even disinfect the washroom after the use of the patient using bleaching powder solution. The only thing is, after cleaning, the bathroom should be left alone for 20 minutes before it is used another time. So, wrapping up, the main important point is you are not infectious after 15 days of your COVID-19 infection, which is the symptom onset. Whether the PCR stays positive after that does not make any difference.